Coronary artery diseases are among the most common causes of death around the world and in Turkey. Risk management with high-tech computerized tomography, CT, coronary angiography, that can image the diseases of coronary artery walls before onset of coronary artery disease gains importance for this group of patients. Computerized tomography is the easiest and most effective imaging modality to visualize the coronary arteries for people with family history notable for complaints related to coronary artery diseases, high-risk patient groups, hypertensive individuals, diabetics, and smokers. Coronary arteries can be visualized effectively within 10 to 15 minutes at radiology clinics with computerized tomography following 4 to 6 hours of fasting periods. Structural deformities and diseases of the coronary arteries can be visualized with tomography scanners within a very short period, less than 1 second, during administration of an iodinated contrast agent in low doses into the vein of a patient's arm. The most significant aspects of coronary CT angiography are use of state-of-the-art scanners and completion of the examination by an experienced team. Coronary arteries consist of remarkably thin vessels measuring 1 to 5 millimeters in diameter. To visualize those vessels that contract 60 to 80 times a minute in the most effective way, high technology and high-resolution devices are needed that can comply with this speed. It is even more important that the procedure is performed by well-trained, experienced teams. The best preference for this kind of a procedure is to have your examination at the best facility with the best scanner by the most experienced teams. Here, the radiation dose and the risk arising out of the iodinated contrast agent require utmost attention. Novell scanners enable very quick scans that may diminish dose of the contrast agent. Now, Novell solutions allow for effective examinations generally with radiation doses 5 to 10 times less than conventional scans. Angiography with computerized tomography is the method that poses the lowest risk to examine the coronary artery and its wall in any patient. In brief, there is no modality that is easier and more effective than computerized tomography, CT angiography, to visualize the walls and lumens of coronary arteries in patients with suspected coronary artery disease. The conventional catheter angiography should be reserved for high-risk patients who have obvious treatment requirements. After a coronary CT angiography scan is completed, patients can continue routine activities of daily life without any restriction. Patients do not require hospitalization or any assistance. Our hospital is equipped with one of the best computerized tomography scanners that is used to image coronary arteries. The dual-tube device allows for an efficient imaging of coronary arteries in 250 microseconds, which equals 1/4 of a synchronous heartbeat. And effective imaging in any heart rate, including high or irregular heart rates, can only be achieved with such devices that offer very high scanning rates.
Etkin bir görüntüleme yapmak ancak bu kadar hızlı cihazlarla mümkün olmaktadır.